Our next speaker is Basem Abu Dagga. And Basem is going to be talking about how the providers network can come together a little closer. And how can these services, shared services, and help us manage our care? How can we get to efficiency in operations simply by helping each other out and working together? How can that help us become more profitable and keep our profits up so we have that economic engine? So thank you, Basem.
Thank you. Hi, everybody. How's it going? I'm back with a vengeance. So this is going to be a relatively brief presentation, and it's going to be about managed care. I will be going through some slides about the current market situation for those that have not seen it, and then we will move on rapidly to the managed care. I'm not the most qualified person to be talking about managed care, but I'd love to shed some light about this for everybody. Thank you. So for those that have missed these, the current healthcare economy and situation there, basically we're talking about a large supply and lots of competition of the smaller polyclinic operators out there. There's also a very large geographical spread, so that applies a lot of pressure on the polyclinics. We're talking about a lot of pressure from the insurance companies, and when we talk about managed care, there's a lot of emphasis on a relationship between the three entities, the TPAs, the insurance providers, as well as the medical facilities. And today, as part of the digital and tomorrow vision, this is a very green operation that can basically do miracles for the healthcare sector overall. So within the overall view of healthcare in the UAE, we're looking at valuations also falling, and there's a lot of challenges on businesses. Many of the insurance providers are also losing quite a bit of money, and so there's a concept that within the challenges of the insurance companies and insurance providers, there's I think over the stats say that there's around over 50 insurance companies in the UAE servicing a population of 6 million or equivalent of people out here. In the UK, just to shed some light, there's 5 companies that are providing healthcare insurance, and that goes to the population that's out there. So you can just get an idea of how competitive it is out here. So a lot of the insurance companies are actually under a lot of pressure, and they are struggling to make money and make things successful. Now, as part of the managed care concept that's been flourishing in many other countries, this is an innovative idea for the region. Very innovative. It is an opportunity, and for those that aren't very well versed with managed care, this is it is used to describe a group of activities ostensibly intended to reduce the cost of producing healthcare and also improve the quality of that care. So technically, you're reducing the cost and improving quality. That seems like it's a paradigm shift right there. It's also becoming said it's been going on in the U.S. since the 80s, and it's an important pillar of managed care, and other economies have started introducing it. What it tries to do is, by reducing the cost, you're looking at economic incentives for these physicians and medical facilities. There's also programs that allow you to review the necessity of specific services. So many times you're applying services that might not be necessary. Increased beneficiary and cost sharing, some of the bigger challenges or incentives of this program. Establishing a cost sharing incentive for outpatients. Selective contracting for healthcare providers, and I think that's basically the core, in a sense, that you're able to qualify and select those reputable operators that are able to deliver what we will touch on. What we'll talk about is the ethical practice. It's a big taboo word when we talk about healthcare and ethics, but I'll use that very lightly if I can. So one of the other things, the other program initiatives are to provide generic medication, and that seems to provide and save a lot of money to reduce the cost and hence improve the quality as well. All right, so a managed care program will build a network of ethical providers. Um, I should keep that very low, hush hush. So yes, when we're looking at ethical providers, these are providers, facility providers that would not take kickbacks or referral fees, will do the ethical service, and will also use generic medication in an effort to reduce the overall cost and burden of the operation. So they will focus on the healthy and quality, or the quality of the healthcare as well, which is what healthcare providers are all supposed to be doing. And then there's a bigger effort using managed care programs to make that effective. They'll also be eliminating payments of referral fees. So I'm treading here on uncharted waters, and I'm hoping people take this with a grain of salt, in the sense that while referral fees are very important for many physicians and medical facilities, it actually provides a bigger burden, and it inspires many facilities to take advantage of some additional services that might not be necessary, diagnostics and lab reports, etc. I'm not sure if you've been into a medical facility recently, but the first question they ask you are, do you have insurance? And what is it? And who's it with? And then from there on, the conversation and the file starts getting, the reports start accumulating. It also the managed care programs prevent abuse of branded medications. So in a case where you can save some money on the operations and all the parties associated by reducing the pressures of branded medication and their expenses, if there are generic medications that can work in, that's something to look at and explore. Eventually, this program would benefit and build those ethical providers. So if you're providing an ethical service, you'll find the patients flocking to your clinics and facilities. And it also reduces the insurance claims, and it improves the overall healthcare industry. So now this is a more holistic level. If you're able to deliver an ethical practice, you're focusing on reducing the overall expenses, and you're improving the top line and bottom line by using generic medication. That has an immediate impact on this whole ecosystem in the healthcare sector. So again, it is an effort that brings in insurers, TPAs, and medical facilities together. So that alone is a big challenge usually. But to get buy-in from every aspect of the game, you need the insurance providers to step in and be able to offer these ethical focused or managed care program focused towards these clinics, and give them the volume of patients that will actually what's the right word? So it will the volume of patients will overcome the loss of revenue that comes in from kickbacks or from referrals and from using branded medication. It also allows us to focus on preventive medication. This is another interesting era. So now this is where you're going into institutions and organizations and entities and inspiring the organizations to live a healthy lifestyle, whatever that means. Worry about do your tests in advance when you should, and therefore you can take out, you can see or capture potential diseases or illnesses at an early stage, which will eventually cost a lot lower. You can also start looking at a healthy lifestyle, more like a better focus on the eating and nutrition and habits associated with that. Another effort through the managed care is to reinforce just healthy lifestyles. It improves the overall organization that is adopting the managed care, and that's we're assuming this is whatever company that's out there has a large number of employees. By having an effort and a focus on preventative medication efforts, it actually reduces sick day leave. It improves employee behaviors within the office and the overall health of the organization. And also introducing exercise. I feel like I'm preaching to everyone, go to the gym and exercise, but effectively that's what a preventative measure can help with. All right. In a recent study, it's been shown that by reducing referral fees, by using generic medication, you can save in a program, an insurance program, up to 30%, which means that while the premiums decrease, it is healthy. It creates a healthier overall sector where the insurance companies are now making money. The organizations are now spending a lot less on their medical premiums or on insurance premiums, and of course the clinics and the polyclinics are also successful in getting more target audience that's coming in their direction. So the overall healthcare costs and efficiencies are improving. We hope to. I think this is if managed care becomes adopted in the UAE and you're able to get the right parties together, there's certainly a great opportunity for the overall healthcare sector.
Thank you, Basem.
Welcome.
Excellent. Question from Russell.
Uh-oh.
Hi, so I'm interested in the idea of managed care. You know, the logic is that it reduces costs and that's part of the advantage. But what happens if the preventative treatment is actually more expensive than what it would be? Doesn't that break the whole system down?
It does, but if you look at the overall costs of taking on board the medication or capturing a disease at a much later stage in the growth of it, or in the when it's evident, then now you are looking at saving a lot more money, because you can treat it while it's still fresh. You can do you can see the diagnostics in advance before they gets to the further level. Now, all the other preventative measures are an additional sort of service that can be applied so that you reduce the overall
So, but do you agree that if the prevention was more expensive, then the whole system breaks down again?
It does to a certain extent, but you've also got those referral fees. You've got the branded generics that are potentially saving 30% of your top line. So that alone is a very substantial figure. The preventive medication is never going to get that far. So unless if you're delivering something that's substantially, this is the top of the line service that's going to go beyond, what the expectations are.
Thank you. Other questions? So I have a one.
Sure.
So I'm wondering, how does this all play in with innovation? So as we see more and more providers maybe coming together and working, say this all works out everywhere around the world, is this a good thing for innovation, or what are your thoughts?
Well, in this specific case, it's certainly a good thing for innovation, because by reducing the overall costs of the healthcare insurance programs and the premiums, there's a lot more money that can be spent in the right areas. So now you're able to find ways to become a lot more innovative, to introduce more advanced methods to save on your costs. And I guess I touched on the ethical practice earlier, so it comes hand in hand. So now you're improving innovation, you're giving a better chance for innovation, and it's all under the ethical premise. So tricky, as you can see, but certainly,
worth doing. Certainly worth doing.
Absolutely.
Thank you, Basem. Thank you, Basem.
Thank you very much. Appreciate it. Thank you.